Okay. Okay, good afternoon, everyone. I'm going to call first of all, I'll call the special closed council meeting to order. And with that, I'll recess it until after the open and closed general purposes committees and the finance committee. So with that, I'm going to call to order the general purposes committee, the open one. May I have a motion on the minutes? All those in favor, opposed, carried. The award of the contract for IT security. Grant, anything to add to your report?
Thank you, Your Worship. No, nothing to add. I'm happy to take any questions.
Councillor, just a minute. Councillor Day.
Thank you very much, Mayor Brody. Thank you for the report, and what could be more important than detecting, AI and other infections into the computer system. And I understand that this program will isolate the problem areas so that it doesn't spread to other computers. My question is, on GP14, they had the best score, which was 67%, which if you were in school would be a C+ mark. I kind of hope for something a little higher than that. Was there no other organizations that could have provided a higher level of security?
The score really is based on a rating scale. Typically it's a 5-point rating scale. It's rare to find anyone having a perfect 5 out of 5 on anything. 67 actually is on the high end in terms of it's more in the 3 out of 5 type range, 3 to 4 out of 5. So I think comparatively, it actually is a good score.
Okay. All right. Good luck.
Okay.
Councillor Au.
Yeah, my question is the agreement draft in such a way that in the middle of the contract, they cannot come back to us to say that we need more money to fulfill the work, things like that? My experience has been that, they may give us a company or an organization a contract saying, okay, we can do this with this much of money. But then in between, they say, no, something got wrong or whatever, they have to update things, lots of reasons. And at the end, they're asking for more. So is the agreement draft in such a way that this is not going to happen?
Yeah, through your worship to Councillor Rao, the agreement actually is formulated as a term of 3 years with an option to renew for 3 years. And so the actual pricing agreement is based on the full 6-year term with commitment that the pricing will be fixed or will be described as it is in the contract for the whole term. So no, there isn't really an ability for them to come back halfway and say, okay, we want more money.
Okay, good, thank you.
Councillor Wolf.
Thank you, Your Worship. My question is a little follow-up to Councillor Day's line there. Seeing that there was half of the proposals came from companies that went over budget in their proposal, some of them as much as 10 times what others bid, like what the winning bid was. So I'm just curious, were all of the ones that went over budget, would have they been more around like the 100% score because they were offering everything and more? And what were the two that offered 6 proposals that had 6 million? Like, what other things were they offering there?
Yeah, through your worship to Councillor Wolf, the proposals we received, actually, all of them had comparable products. And so really the responses were essentially a combination of a solution, a technical solution, which is a product, as well as services to manage that solution. And it was important to us that we have a 24/7 monitoring and management so that we had early indications if there were issues or problems. Some companies, of course, did not offer any managed services, and so in that context, it really wasn't viable for us. The ones that were top scored had very similar product. In fact, I think one of them had the same solution, the same technical solution. It's just that they were completely priced out. We could not see any reason why it would be so expensive for them to provide that service to us. It was just not comparative at all.
Great, appreciate that, thanks.
Okay, may I have a motion, please? Moved and seconded. Any further discussion? All those in favor? Any opposed? That is carried. That brings us to a motion by the councillors Galanders and Heed. What I plan to do, subject to anybody's comments, before we get into our own discussion, let's hear from, there's various delegations. I've got 7 of them who pre-registered, plus we have a list out in the hall. There probably are a few more on that. So let's hear from the various people. First of all, we have Ken Frail. Please come forward, sir. Introduce yourself, and you're given 5 minutes.
Thank you, Mayor and Council. My name is Ken Frail. I've been a resident of Richmond for 40 years, police officer in Vancouver for 35. 12 of those were spent in the downtown east side, 9 directly in charge of enforcement initiatives, and I was the department's link with the Vancouver Agreement. Vancouver Agreement was a attempt by the province of British Columbia, the city of Vancouver, and the federal government to deal with the emergency with Dr. John Blatherwick had announced the public health emergency of the overdoses in the downtown east side. I was responsible for that for 9 years. When I volunteered to be part of this initiative to try and work with other agencies to reduce overdose deaths in the downtown east side, I was searching for a way to evaluate it. And one day I ran into Sergeant Heed in a hallway, and we discussed how I might evaluate that program. And he suggested, well, maybe, Ken, you should follow the overdose death rate. In 1997, when I started this project, we had 197 drug overdoses in the downtown east side. At that time, that seemed like an awful lot. And I remember thinking it's a tough way for a police officer to evaluate a program, because I can't stop somebody putting a needle in their arm. I remember thinking that's such an unfair way of doing it. But what I learned was it's not a measure of what we're doing as a police department. It's a very good measure as to what the community is doing to respond to that. So it's really a measure of community response to that epidemic. Now, the downtown east side may seem like a completely different environment than Richmond, but there's one thing that's similar. When someone uses street drugs, which aren't quality controlled, they're taking a real chance. You can either have a life-threatening overdose that shuts you down and stops your heart and your breathing, or not. But if that happens, response has to occur within a couple of minutes. And if it doesn't occur within a couple of minutes, you've just lost a life. Canada Day, my wife and I went to the Richmond Oval for a workout, 9 o'clock in the morning. We saw police and fire coming out from the underground, having worked on an overdose near the areas where the electric cars are charged. And I talked to the fire crew. And basically, the person that had the overdose refused further medical care. And I watched the ambulance crew go away and the fire crew go away. And I thought, on Canada Day, in this city, which is a rich city, there's no way that our emergency resources that have just been called to help someone should go away and not really have an option to direct that person someplace else. That's not good enough. I took a look at this is what I found when we did the project in Vancouver. When we did the joint project in Vancouver, it brought resources together. It brought police, fire, ambulance, advocates, health, city, social services, and employment standards. We gained from working together. We started out with a lot of distrust between agencies and certainly the community about why are we all here working in our different silos. But the real work happened on the street, at the street level. We developed linkages, coordination. A lot of our people really became switched on because we were now participating instead of responding. We went from 197 drug overdoses over a 6-year period to 44. It's an 83% reduction in overdoses. Our homicide rate dropped by 50%. Our crime went down in all categories. we had a sense of hope and community safety. And when the shit hit the fan, we knew who to go and see in another agency to resolve an issue. But I have to acknowledge one thing. We were dealing with heroin and we're dealing with poly drug use. We were not dealing with fentanyl. Fentanyl is a lot more dangerous. And I think we're assuming right now that things won't get worse. They might get worse before they get better.
Sir,
Right now, the city of Richmond's responding to overdoses on an emergency basis.
Sir, your time is up.
Okay.
Please just summarize and finish.
Okay, I'll say that I read the motion, and I'm fully in support of it. It asks for analysis, participation, education and awareness, monitoring and measurement, and it's well thought out. Thank you.
There's a question from Councillor Day, and all we're doing is asking questions.
Yes, exactly. So my question is, with your previous experience, does it help? You mentioned the OVO situation, and then everybody left and the guy was still in the parkade. If there is a consumption site near a hospital, do you think, like in that case, for example, or in other cases that you dealt with, that that person would seek additional help?
Two things out of that. One is, I know as a police officer that if you, and I've been on Hastings or whatever, when you come across somebody that's using drugs, you don't do it here, don't do it in this lane, don't do it behind this dumpster, go across the street to do it there. At the incident at the Oval, what bothered me was when I came down after my workout, I talked to the front desk and said, are you aware that there's been an overdose in the underground? And they hadn't been made aware. The emergency services that were there, at that point, there's no follow-up, and there's not a chance for them to be able to do a great thing and refer them to someplace else for follow-up.
Okay, I just have one quick question. So education, how big of a part is this in your previous experience?
The sad part with the Vancouver agreement was that there wasn't a huge emphasis on outreach education. We had some fantastic police officers that made a film called Through a Blue Lens, and we're doing a whole bunch of outreach work on their own. But that's one of the, I discussed this with Councillor Heed when I looked at the motion and said there's got to be an emphasis on education here. When I read the proposal over again, I see that's in there, and he's assured me that that would be a part of it.
All right, good.
All right, thank you, sir.
Thanks. It was hard to summarize 9 years into 5 minutes. Thank you very much.
I just want to remind council and the public, the resolution that is going to be on the table doesn't talk about being near the hospital, it's at the hospital. So the next speaker is Sheldon Starrett, followed by Donna Colpitz, and then online will be Winnie Tang. So if the others, those other two could be ready to speak when this gentleman is finished.
Good afternoon. My name is Sheldon Starrett. I am a resident here of Richmond, of the city centre, particularly of Alderbridge and Westminster. I am speaking in opposition to this motion, and I have 3 main points that I want to iterate here today. The first point stems from the follow-up on the temporary modular housing in Richmond. With those put in place, we have had increases of needles, drugs, crime, public disorder. At the last meeting, we discussed that here at council. Many of the councillors agreed the city had not done enough to mitigate the negative impacts of the modular housing. And there hasn't been any follow-up on that. And so I do have concerns that with an injection site put into the hospital, that the city may not have the resources to mitigate the negative impacts of that. Many residents in the city centre across more than a dozen different condos have been engaging in conversations, and many of them are concerned and worried about this. The second point, this has been done before. This was done at St. Paul's Hospital. An overdose prevention site was put in there in a hospital precinct, and a care worker there was stabbed and died of his injuries. That care worker, his name was Thomas Donaghy. After that happened, St. Paul's Hospital demanded it to be removed out of the hospital precinct. And so the City of Vancouver implemented another one, the Thomas Donaghy OPS, in Yaletown around Helmkin and Seymour. And that implemented in 2021. That is being shut down as of last year by Vancouver City staff and Vancouver City Council because of issues of crime, needles, open drug use, indecent exposure of people running around naked in playgrounds. There is a lot of problems associated with that, and so city staff in Vancouver decided they have to shut that down because of the problems it is causing. So sometimes I think the definition of insanity is doing the same thing over again and expecting different results. The third point is, I don't believe that this will help the people in Richmond who are overdosing in private dwellings. It may help in parts of Vancouver where you have a larger transient drug-using population, but I believe it is different. I believe people who are overdosing at their homes, who are using drugs recreationally, are not going to go to a brick-and-mortar hospital, government building to do drugs recreationally. And so we are missing the ball on getting help for them. The answer here is more education, more treatment. What is the City of Richmond doing to support treatment centers and rehabilitation in Richmond? To my knowledge, I'm not aware of anything. And so if we're going to put an injection site before treatment centers, we are putting the cart before the horse. And I think that's untenable. I think people in Richmond, a lot of residents, they are wondering, is it wrong to want to be safe in their cities? They also just want, some of them have asked me today just to remind council that they will remember in the next election. And if the downtown east side comes to Richmond, they will hold the councillors here responsible for creating those conditions. And then one other piece of housekeeping, some of the residents had concerns about the sponsor of this motion. And so while they had a lot of things to say, I said we should be a little bit judicious with how we phrase things. And so they just wanted to know if Councillor Heed is still, if he has any involvement with Lucy Scientific Discovery. I'm not sure what this company does. I've had to look up it. If he no longer is involved with that, would he just be able to state when he was involved with that? And I think that would clear the air for lots of residents who just have some questions about that.
Okay, sir, we're going to interrupt you because you said something naming a counselor. The first point I want to make to you is this council is always accountable for the decisions we make. So we don't have to be reminded that we're, this implied threat of election results, negative election results, if we don't do one thing or another. Please keep that in mind.
Yes.
Now, in terms, I'm going to let you finish, and then I'm going to go to Councillor Heed, who can make any comment that he wants. Are you about finished?
Yeah, so the majority of the residents, they're not against treatment, they're not against rehabilitation. They would like to see the city focus more on helping save lives and offering these people dignity in overcoming these obstacles.
All right, thank you very much, sir. I'm going to go to Councillor Heed for any comment you wish to make.
Yes, point of order with respect to the allegations that are made by this individual coming forward. He has received correspondence from me that has been directed to him, and he knows the outcome of that correspondence. And a point of information, and I think we should be very cognizant of this, the motion that will be coming forward is related to a supervised consumption site, not an overdose prevention site. There's quite a difference between these two, and I think we have to be aware of it. There's 39 consumption sites across Canada issued by a CDSA exemption from Health Canada. The overdose prevention sites are an exemption issued by the provincial health minister with respect to this. So it's two different entities that we're speaking about.
All right, thank you. So the next speaker is Donna Colpitz. She'll be followed by Winnie Tang online and then Debbie Tablotny. So if the other two could be ready to go when this delegation is finished. Yes, ma'am.
Okay, can you hear me? Okay, my name is Donna Colpitz. I'm a retired outreach worker and before that an addictions counselor. And the point I really want to make is that people cannot recover if they're dead. Richmond has a really strong community of people that are recovering from substance use. They are people that I know personally that have got many years of sobriety, of clean time. Many of them have got more than 10 years. These people are now working in our community, they're paying taxes, some of them are raising families. Many of them are active in the community, they're helping other people attain and retain sobriety. They're really like very much contributing members of society. Pretty much every single one of them relapsed at some point along the way. Many of them relapsed many, many times. They kept trying, eventually they succeeded. With today's toxic drug supply, one relapse can mean death. Like some of these people would not have survived. And a couple of people in particular that we lost this last year really come to mind. They tried many times to quit using. They never really gave up. The last time I spoke to both of them, they were still talking about reconnecting with family, repairing relationships. They wanted to get clean. They never really gave up. I think that I really do think that eventually it's possible they could have succeeded. Instead, they're dead. And I think this is really heartbreaking, and I think this is really wrong. I think we need to do better. I don't think we can expect people to jump from using regularly to going directly into recovery and all of a sudden being okay. If we can't keep them alive, they're never going to get better. And I think that a lot of people seem to think that like having this type of facility is going to encourage or promote drug use. But I don't know anybody that doesn't use drugs that is going to suddenly decide to start using because there's a safe consumption site. And I think it's pretty obvious that the people who already are using aren't going to stop because we don't have one. So I don't really think that's going to make a difference. I also think this is a good starting point for people. Like a lot of people are not comfortable trying to access services. This is somewhere where they could go, they could be met where they're at without fear of judgment. They can develop relationships with staff, and maybe they'd become more open to other services. This isn't a solution, obviously, but I think it's a first step. I think the whole system needs to be fixed. Right now, people are not able to access a lot of the services that they need. I'm hoping that because this falls under the health authority, that it also might make it easier for people to get into something quicker. Right now, the wait time to get into detox is up to 2 weeks or more, up to 8 weeks or more for treatment, and even for outpatient drug and alcohol counseling, there's a couple of months wait. So we need to fix the whole system, but I think this is a really good place to start to keep people alive so we can get them connected to all the other things. The other thing I think is that right now there's so much backlash against seeing people using in parks, finding paraphernalia. This probably won't eliminate it, but it should cut down on it a little bit. And as far as private residences go, yes, there are some people that are still going to use at home, but we do also have people who, if there was somewhere safe where they could go and get their drugs tested, they wouldn't be judged, they wouldn't be facing the stigma, I guess, then it's possible we could save some of those lives too. And I think that should be the main thing here, is saving lives. I think what we need to do is remind ourselves all the time that these are real people. They've got families who are hurting. They're not just statistics. And I'm going to stop there because I can go on for hours.
Okay, thank you very much, ma'am. The next speaker then is Winnie Tang, who is apparently online.
Yes. Hi. Hello. Dear Mayor and City Council, thank you for the opportunity to speak today. My name is Winnie, a resident of Richmond. I, along with many other residents, I would like to strongly oppose the establishment of a safe consumption site in Richmond. I'll begin by acknowledging the potential benefits of these sites. However, we must critically assess whether Richmond really needs such a facility, especially in the hospital and mineral area. To illustrate why a site won't work in Richmond, let's consider the example of a Yaletown overdose prevention site, which, if I recall correctly, also provides supervised consumption services. And like the previous delegate had mentioned, it is closing after just 3 years. Unfortunately, it became a hub for open drug dealing, leading to a surge in criminal activities and prompting 2 class action lawsuits against the city of Vancouver. The cleanliness issue was also significant, with discarded needles littering the area despite efforts to clean up. People were seen also lying on the ground nearby the site. Vancouver chose to close the site for these reasons. And if Richmond opens a similar site, we could face the same problem, with increased criminal activities and needles in the areas like Richmond and Mineral Park. These areas are frequented by international visitors, seniors, children, and families, which poses a serious safety concern and our cities and to our city image. You might argue that the other sites have been successful. However, we really need to think about their location. The East Hastings site, the Surrey-Whalley site, are strategically placed in sites within those cities with high concentration of drug issues and crime rate already. This aligns with their purpose. Vancouver accounts for 26% of unregulated drug-related deaths in BC, Surrey at 9%, which both are far, far higher than Richmond's 1%. The trade-off of safety concern in Vancouver and Surrey may be acceptable because of their higher drug-related issues. However, Richmond has significantly lower population of these users, and the trade-off of community safety in view of the site is not worth it. Moreover, establishing a site in Richmond poses risks of attracting more drug users, dealers, and gangs from neighboring cities, exacerbating the concern regarding crime and safety and homelessness. Richmond's crime rate, according to the City of Richmond website, has nearly doubled in the past years, escalating from 1,145 to 2,400 reported crime locations. We cannot afford more crimes. The closure of East Hastings tent site has already led to an increase in tents near our municipal building. We're dealing with more homeless issue now, and this will put more burden on our city. The increase in tents also indicate that people migrate, which means that having a site in Richmond will draw drug users from elsewhere. Then it will exacerbate the issues I discussed. More users and drug dealers entering Richmond, escalating crime rates and homelessness rate, and overwhelming our city's hospital and first responder resources. And this is a spiral. Is this a trajectory we desire? Since the site's proposal was announced, many Richmond residents have expressed strong opposition and take further action. Some residents have already emailed you with their opposition. I'm sure some of you received that. Especially, even at this early stage, there is a significant opposition, and this reflects the sentiment of Richmond residents. I implore you, mayors and councillors, to explore other ways to help drug users, such as more education, prevention, and perhaps adjusting the criteria of modular housing, which also offers consumption services, in a more targeted approach to help these residents. In summary, I want to stress that given the Richmond's relatively lower incident of drug-related problems, the safety and crime risks associated with the consumption site far outweighs the potential benefit. It is imperative that we learn from the experience of other cities and avoid endangering the safety of our broader population. And thank you for your time and consideration.
All right, thank you very much. The next speaker is Debbie Toplotny. Following her would be Andrew Toplotny, then Trevor Toplotny. So if the others could be ready to go, please.
Hi, yes. Good afternoon, Mayor Brody and Council. My name is Debbie Toplotny, as stated. The opposition to supervised consumption sites, such as the one proposed by Councillor Heed, is one of values, and it raises the question of whether we should perceive drug users as human beings who are worthy of the same health care most of us have access to. Arguments offered by opponents of harm reduction are such facilities enable drug use, and that these individuals do not have the ability to stop using drugs, and therefore funds should be spent on abstinence-based treatments, not programs that promote active drug use. Many opponents feel that drug use is immoral and should be dealt with through enforcement and criminal justice system. There's a large body of evidence to counteract this argument because it has been proven that addiction is a medical disorder that warrants expert and ongoing medical care. Attempts to control addiction through abstinence programs and criminal justice measures have proven neither effective nor economical. The criminalization of drug users has also been shown to increase high-risk behaviors and elevate the risk of acquiring infectious disease. Studies have shown that injection facilities or consumption sites have no adverse effect on drug use in the broader community, such as increasing rates of initiation into drug use among vulnerable populations. Ultimately, these facilities appear to help advance the very goals that their opponents espouse. And we must focus on how to facilitate the implementation of new supervised injection and consumption sites in Canada, not on whether such facilities should be opened. Evidence shows that supervised consumption sites reduce overdoses and substance use harms and connect people with health services that they greatly need. They reduce unsafe drug use practices. Evidence suggests that they reduce needle and other debris as well as public intoxication because the use is inside the facility. Since January 2016 to June 2023, 40,642 Canadians died from opioid-related overdoses. 39,435 opioid-related hospitalizations and 16,832 stimulant-related hospitalizations. Many of these people were experienced in the use of these drugs, however, succumbed to the contaminated supply. Without facilities such as the one proposed, there are very few methods to ensure that the illicit drug supply is safe. Public health measures are essential to reduce harms due to the toxic drug supply. Supervised consumption sites ensure that people using drugs can do so safely if an overdose occurs, and healthcare providers can intervene. Consumption sites provide clean equipment to use the drugs on site, not outside or in public, and this prevents people from resorting to dangerous consumption practices. Most importantly, it ensures that drug users are not using alone with no one to intervene in the event of an overdose. My husband and I were able to treat and call for first responders when my son overdosed at home. It was when he used at his new home alone that there was nobody available to help him. I'd like to think that if he had the opportunity to use his drug of choice safely and anonymously at the Richmond Hospital while he was battling his addiction, he would still be alive today. So thank you all for listening, and I'm speaking very much in favor. And I also, I've printed one copy of this. Supervised consumption sites are necessary public health services. This is an evidence brief, and it was done by the Canadian Institute for Substance Use Research at the University of Victoria, and I will
All right, if you could hand it up to the clerk, please. But we do have a question from Councillor Day.
Okay, thank you. Thank you so much for that information. And of course, you're trying to rattle it off in 5 minutes. So I was wondering if you could repeat the numbers that died and the numbers that overdosed, because I'm just thinking, if you don't want to take compassion off the table for a minute, what would the cost savings have been? So would you mind repeating those numbers, please?
Well, since January 2016, when the opioid crisis was declared, to June 2023, 40,642 Canadians and died. And there was 39,435 opioid-related hospitalizations. Those people obviously did not die. They were in the hospital. and 16,832 stimulant-related hospitalizations. And I can tell you when my son overdosed, and that was several times, at least 7 in our home, there were many first responders that had to respond to the crisis, and it must have cost a fortune for that one overdose. It was a parade of people coming in to save his life. Wow. So
Okay.
it has to be very costly.
Thank you very much.
Okay, thank you.
The next speaker is Andrew Tablodny, then there's Trevor Tablodny and David Byers. So if the others could be ready to go. Yes, sir.
Thank you, Your Worship, Council. My name is Andrew Tablodny. I've been a citizen of Richmond for the past 42 years. I'm going to start off by reading a letter from a gentleman called Guy Felicello. He's sorry, is that better? Closer? There we go. Okay. This is from Guy Felicello. He's an advocate of safe supply and overdose sites. To whom it may concern, I'm writing on behalf of my support for supervised consumption sites in the Richmond area. My name is Guy Felicello, and I'm a former drug user who had been brought back to life multiple times. In 2003, when the Insight supervised consumption site opened, I was one of the first people to register. Little did I know that how much of a role that facility would play in me breaking free from my addiction. I used the facility over 4,000 times and was brought back to life multiple times through nurse interventions. I frequently accessed the detox and treatment as well as their connection to other health services for multiple health complications during that time. What is often overlooked about supervised consumption sites is that it is much more than a facility for using drugs. It is also a powerful tool to provide human connection for people who are struggling. Addiction is a chronic, lonely condition. It is only met with stigma and discrimination, which drives people to the darkest places to use alone. We do not build connections with people in isolation. However, we do build connections when we provide a place for people to connect. The importance of supervised consumption sites is not only to reduce public consumption, but for the more important aspect of it is that the evidence is clear. These facilities save lives. My last overdose occurred February 18th, 2013, when I was revived by Nurse Sarah. When I came to, I visibly could see she was emotional, and I asked her, "Why are you crying?" And her response was, "Because I care." In that vulnerable moment, I burst into tears. On that day, she helped me get into the detox facility upstairs, in which my recovery journey began at that point. Today, I've had over a decade of sobriety, a beautiful family with 3 young kids, an important career, and I'm an international public speaker who educates teens, communities, and colleagues on harm reduction, addiction, and recovery. To be frank, without supervised consumption sites, I wouldn't be alive today. I wouldn't have the life I have today, and I wouldn't have my family, my career, and my passion to help others who deserve the same opportunity at a second chance. What this facility did for me, it has done for many others. Supervised consumption sites are healthcare facilities for people who use substances and not only save lives, but they also help change lives. It is my hope that the City of Richmond gets behind this vital facility because the reality is grim. The drug supply that is in our community is killing 7 British Columbians every day. At a certain point, our communities get faced with a decision to prioritize the lives of substance users and treat them with compassion or drive them further into shame and isolation, resulting in more families being told that their loved ones have died of an overdose. I encourage the City of Richmond to consider being a light in the grim realities of our current overdose crisis and open a facility that will save lives. Some of my own thoughts. With the overdose crisis was declared an epidemic 7 years ago, it was only in the past 2 to 3 years that the public has started to come to grips with the reality of what this epidemic is all about. Those in the medical field, emergency services, and people directly impacted by overdoses have seen the results of the damage it has caused for many years. The public awareness has increased as more information stories have been published. The province has only just begun addressing the issue of recovery beds and is way behind the curve in supply. Until that improves, overdoses is the ongoing reality. So Richmond is more or less on the leading edge of finding solutions in dealing with opioid overdoses in our community and has an opportunity to show leadership in developing systems and programs to improve our recovery rates and contribute to the reduction in consumption and/or provides safer opportunities for those addicted until such time as they can seek their road to recovery and more facilities become available. A couple other comments. There was a comment about the cart before the horse. The problem is that unless you can identify who the people are that have the addiction, then you're never going to be able to provide the recovery. So I think the gentleman had that comment backwards. And also the issue about needles everywhere. Well, I think my wife expressed the statistics show that it doesn't happen, but if we don't do anything, the needles are still going to be there. They'll still be in the parks and they'll still be around the other places. So, we need to do something, because doing nothing is not going to solve the problems. Thank you for your time.
All right, sir, thank you. We'll call upon Trevor Toblotny, then David Byers, and Jeff Goldby.
Thanks for giving me the chance to talk. I'm a little emotional because I did lose my brother. You'll see his car's out there when you leave. I would rather have my brother than the car that I pieced together. My name's Trevor Toblotny. I grew up in Richmond, lived here for the last 40 years, and I'm a local musician. I play in the downtown east side all the time. I tell you right now, I feel safer in the downtown east side than I do on Granville Street, and the safe consumption sites on Granville Street serve liquor, and I feel more threatened by that than the downtown east side. I can also say I work in the film industry. I'm in those alleys all the time. What I noticed when we put in Insight was a decrease of the visible needles that were out there in the scene. When I was younger and before Insight, we would shoot, and in the alleyways, all of the telephone poles would be needles. And that went away around the time that Insight happened. But that's not what I wanted to say today. What I wanted to say was tell you guys what the actual lived experience that my family went through with my brother. Okay, when he would overdose, my parents would have to get control of the dogs. My mom's on the phone with the police. My dad is resuscitating my brother on the floor. Numerous police officers and fire and ambulance have to show up. Then he goes to the hospital, and a doctor looks at him, and a nurse looks after him, and he's in there in the hospital for the weekend, and then he gets let out. And then we wait another 7 months six or 7 weeks for this to happen again. And it's just, how many resources is that taking up when you could have 1 or 2 nurses supervising the consumption of individuals with narcotics, and they're present and they're there. And not only that, the resources that we lacked for finding my brother the support for rehab, for treatment. What are the odds that somebody was there that would have been able to offer that, some kind of support of where he could go to stay clean? It's not just about using drugs, it's about a community and the opportunity to have somebody there. So you're not doing it in your bedroom, you're not hiding it from your family, you're not hiding it from your workplace, and you're not hiding it from your peers. Because we've stigmatized drug use. We've said, you do drugs, you're a criminal, you're bad, you hide it. And that's why you find the needles in playgrounds where they're doing it at night in the dark. And that's why you're finding it in the playgrounds. We have to come to terms with the fact that people do drugs, and we need to figure out how they can do it safely. And we need to make sure that people are supported in this community, because I can't watch another person lose somebody. Last year I lost one person in my circle, at least one person a month, from about January until June. And it's really hard to deal with this. From the evidence that I saw looking at safe consumption sites, there's next to no deaths in comparison to the amount that we're seeing. Like we could fill almost 3/4 of Rogers Arena with the amount of people that have died since 2017. It's a lot of people. And there was maybe 1 death at the safe consumption sites. That's a lot of a display of success if there ever was. There's a nurse there ready to resuscitate you if there is a problem. And then there's also that conversation to have after. This is where you go to get treatment. The letter my father read. He woke up. That was what he needed. Everybody's rock bottom is different. Everybody's opportunity, and that point where you make that decision that I want change, it's different. And you need to be there instantly offering the solution. I agree with the opposition that are saying we need to be able to do more for recovery and we need to be able to do for all of that, but it's a multi-tiered system that we need to be able to offer. We need to address the crisis, and we also need to address the treatment. We do, definitely, I agree. We also need to address the education. But a safe consumption site makes sense. You cannot leave this on the back of Vancouver. It's not a Vancouver problem, it's an everybody problem. I don't know why there isn't one in every major city offering the opportunity. I can't guarantee that my brother would have used a facility like this because he's not here. I can't ask him and say, hey, could you go use this safe consumption site? But what I can say is that he definitely wouldn't have traveled to Vancouver to use it and then have to come all the way out here, because that is not only incredibly inconvenient, but try talking to someone that's on drugs. They won't listen, But if the facility is here in Richmond, the likeliness of them using is a lot better. And the outcome, as proven, is that these people survive and we save some lives. So thank you for your time, guys.
All right, question by Councillor Day.
Yep, thank you very much, and thank you so much for speaking today. I know it was very difficult. Do you think, a firsthand experience with your brother, and I'm very sorry for your loss, if there was a place like this where he could have tested his drugs, he would have used that facility?
I definitely think that if we had facilities for testing drugs, that he probably would have tested his drugs and made sure that they were safe, yes.
Because no one buys drugs hoping that they're tainted, right?
I don't believe that drug users are buying drugs hoping that they will die, especially the ones that are using safe consumption sites. They are definitely there because they don't want to die, and that alone is a sign of the opportunity for recovery.
Yeah, thank you.
Thank you.
Okay, no, thanks. We've got 3 more speakers, of which I'm aware. David Byers, Jeff Golby after Mr. Byers, and then Manani Lim. If you could, the other 2 could be ready to go. Yes, sir, please introduce yourself.
Hello, Mayor and Council. My name is David Byers, and I was born and raised in Richmond. I'm also currently an employee of the BC Centre on Substance Use, though I am not here speaking on their behalf. I am also previously an employee of Insight, working on the downtown east side, as well as having worked in numerous overdose prevention and supervised consumption sites around the province. I currently work as the provincial training coordinator for the drug checking project, and I have been honored to work as a drug checking technician alongside people who use drugs around this province. I come to you with lived experience of working directly on the downtown east side, and the people on the downtown east side are but a small fraction of the people who use drugs in this province. The people who use drugs in the province will not be identified by the people living on the street. The people who use drugs are in our community, in our lives, and we may have possibly no idea. I have also seen the firsthand impact that a safe consumption site can have on individuals' health and well-being. And by that I mean the wounds that have an opportunity to heal, the people that have an opportunity to be warm and access water and a washroom, the bare minimum that we deserve of dignity. They have the opportunity to access detox and recovery services, and obviously the life-saving impacts of an overdose being reversed by the staff on site. People accessing consumption sites have been proven to create better connections with healthcare providers, to their community, and to their peers. It allows the dignity, safety, and life that they deserve. While you may imagine that the downtown east side is very different from Richmond, we must remember that people who use drugs are everywhere. Let me be clear, the people living on the downtown east side will not be migrating to Richmond for a supervised consumption site. The supervised consumption sites are present in Vancouver and they will remain there. They are not going to move across cities and bridges in order to access a service that is in their backyard. We are also now in the 8th year of a public health emergency, and we must address it as such. We cannot wait any longer to address 7 British Columbians a day dying. Those are people's kids, those are people's parents, those are people's family. We cannot wait any longer. We owe, as citizens of a community, compassion and care for those around us. And in this circumstance, if it takes the form of a supervised consumption site, then that is what it must be. The research is clear. Injection sites and harm reduction work. They save lives. They create better health outcomes. It reduces the load on emergency services, provides engagement with health services. Communities are made safer. Early research on Insight showed that in its first years, it prevented 83.5 HIV infections per year, which alone is $17.6 million in savings on the healthcare. Not to mention, given the current complexity of the drug supply, as somebody who on a daily basis monitors our provincial drug supply through drug checking data, I can assure you the drug supply is increasingly toxic, the drug supply is increasingly complex, and we cannot keep up. There are fears around people who use drugs being perceived as criminals and destroying our communities. The people who use drugs are a critical part of our communities, and we cannot pretend that they are not a part of your daily life. There are many OPS and supervised consumption sites in Vancouver, including the ongoing successful supervised consumption site operating out of St. Paul's, operated by Rain City, where a peer is able to support their peers in accessing a safe consumption site while accessing treatment or the emergency department at St. Paul's. The same could be true of Richmond Hospital. The bare minimum that we can do is to keep people who use drugs alive. It is not a high expectation. We must keep people alive, and a supervised consumption site provides us the opportunity to do so. There is an intense stigma around people who use drugs that we have seen from other delegates today and in the media, and we will continue to see many years from now. It is harmful and it is dangerous, and it harms the people who use drugs and the people who love and care for them on a daily basis. Thank you.
We have a question from Councillor Day.
Thank you. It's nice to speak to someone that has been on the front line, as you obviously have. You mentioned that St. Paul's was open. We had a Mr. Starrett earlier say that it was closed because a worker there was killed. Could you clarify?
St. Paul's provides an overdose prevention site. It is operated by Rain City. It is currently operational. I ran a conference at St. Paul's in October in which we had clients of our conference accessing the overdose prevention site, and I worked closely with the people operating it.
Perfect. And as a kind of frontline worker, I think more than anyone, did you ever feel threatened? Because we hear about these people that were killed that were workers. Could you talk about your own personal safety?
Absolutely not. Obviously, we have safety protocols in place for if things do escalate. However, the reality is that as frontline workers, when we build connections with the people that we are caring for, that is all it takes. It doesn't take a whole security team to manage it. We don't have security at Insight. There are no security staff. There are no police on site. It is connection with the people that we are serving that allows us to keep ourselves safe and keep themselves safe. They don't want to hurt us. They know that we are there to provide a service that helps them.
Thank you. That really clears it up for me. Thank you very much.
Okay, thank you very much. Next speaker is Jeff Golby, followed by the last speaker, which is Manani Lim. Yes, sir.
It's a tough act to follow. I'm a Stevenson resident, and I also support the motion. Most importantly, I support a motion to investigate it, to come back with informed information to make a proper decision. My name is Jeff Golby. My wife works on the downtown east side in an addiction recovery center for the past decade. Prior to that, she worked as an outreach worker on the downtown east side, which is essentially like a street or frontline worker. My best friend works in addiction recovery. My brother works as an ER physician, but prior to that did drug testing at large mass events. It's really hard to get a dead person into detox was also my line, so thank you for using that as well. Safe injection and safe consumption sites, by some data points, have proven to be an 89% lead into helping people get into detox programs. We're dealing with, as everybody knows, an unprecedented toxic drug supply. So why would we not want to offer a means for people to test their drugs? I think it's a little bit of a disingenuous argument to suggest we don't want to keep people in addiction, which is sometimes the argument that's presented for why we don't want to offer these types of programs. I think we can do both, and the data shows that this is an effective measure into getting people into detox programs. Of course, no solution is perfect because humans are messy, and this is an unprecedented, complicated issue with a very toxic drug supply. In the work that I do, working with Indigenous population, we try to practice nothing about us without us. And unfortunately, as I've been sitting here at the back, I can't help but notice my privilege, and this isn't anybody's fault, but I just noticed that there's a lot of talk about them without them, and I'm using that in air quotes, which I know is nobody's fault, but we're really fortunate, generally speaking, here to be talking about a population or a group of people without that group of people necessarily here. And I know I'm making some assumptions there too. So one of the reasons why I so support this motion is it enables counselors and city staff to go out and speak with those living in addiction, speak with those going through the recovery process in detox, living in Richmond, currently in addiction. The data is not hard to come by. It's extremely robust and quickly available. And the National Library of Medicine shows that safe injection sites result in a 35% drop in drug-related deaths. In Spain, it resulted in a 50% drop, 89% increase into the acceptance into an addiction recovery program, an incredible 80% reduction in infection, which then reduces the chance of HIV/AIDS. And I know that data rarely changes minds. So I guess the big question is, what's the data point, or how many is too many? And when I need help, or my loved ones do, or those that we know, like our family and friends, of whom we've lost about 8 people due to overdoses over the past while, many of them as a result of my wife's work, I know I want data over dogma. I know I want the best treatment options available for them. So I'm encouraging City Council and the staff to help build the kind of society that works for all of us. So thank you for putting this motion forward, and I look forward to seeing the data that city staff come back with and working together to build that kind of society. Thank you.
Thank you very much. And the last speaker will be Benani Lim.
Good afternoon, councillors. Mayor, thank you for the opportunity to speak.
Please pull in the microphone as best you can.
Is that good?
It's better.
So I would like to speak as a downtown Vancouver resident who recently moved back to Richmond. So I've lived across from the St. Paul's in the injection site, worked in Yaletown. Right now, currently working the downtown east side. So I have seen a lot of people suffering, and I do want to see their lives saved. I empathize with people who have lost their family members. It's a tough battle. I think we're all trying to save people. My concern as a Richmond resident, because living downtown, I've been attacked twice close to the site. I've also seen various drug use, open drug use, moms and kids being attacked in parks, especially during the pandemic. Everyone's lives is equal. Everyone's lives is important, and want safety for everyone. And I'd like to know how the city plans to ensure our safety, the measures being put in. That's really my concern. Basically that's it, because I've seen, I think as many of you have read downtown, do I feel a threat? Yes. Did you feel afraid? Yes. Was I being punched? Yes. These are all my personal experiences. Others may differ or disagree, which is completely fine. I've stayed in St. Paul's Hospital for 3 weeks as well, and they kept calling code blue. I was beside people who were on addictions in the hospital who were suffering as well. I completely empathize. I talk to them on the street. I try to offer food. People are suffering, yes. I don't know. I think we're not opposed to saving lives, but we're concerned about our safety, and I hope that is just being understood, rather than, I don't think there's a solution by being you versus me, this versus that. I think, isn't there a compromise where people can still be safe? That's all I want to say. Yeah, thank you.
All right, thank you very much. So that concludes the speakers. So I'm going to go to Councillor Heed, who is one of the proponents of this motion. Go ahead.
Thank you, Mayor. I just want to make a point that Councillor Glanders is an integral part of bringing this motion forward, and I know she has some things to say with respect to this. I just want to make a few
Just a minute.
comments.
Do you want to move your motion first?
Do you want me to move the motion
I do.
first? Okay, I'll move the motion, and my motion is that staff administer a practicability analysis to gauge the potential benefits and challenges of implementing a drug consumption site within the Richmond General Hospital precinct. This analysis will evaluate the impact on public safety, healthcare costs, and community perceptions, providing evidence-based recommendations for the successful implementation of a supervised drug consumption site to address the growing public health crisis related to acute drug addiction and overdose deaths. That staff collaborate with Coastal Health as the authority responsible to fund and provide services on site. Both the provincial and federal governments, local healthcare providers, and community organizations in establishing the drug consumption site. This collaboration will ensure that individuals accessing these sites receive comprehensive care, including access to addiction treatment, harm minimization services, and counseling. That staff recommend to council a process to establish a task force comprised of representatives from law enforcement, legal services, healthcare professionals, community organizations, and individuals with lived experience of drug addiction to develop guidelines, protocols, and best practices for the implementation of the drug consumption site, ensuring its effectiveness, acceptance, and safety. That staff recommend to council the resources required for community education and awareness campaigns about supervised drug consumption sites. These campaigns will aim to dispel misconceptions, reduce stigma, and promote understanding of the public health benefits associated with these sites. That staff recommend to council a monitoring and evaluation system to assess the effectiveness of the implementation of the drug consumption site. This system will collect data on overdose rates, healthcare utilization, and referrals to addiction treatment, allowing council to make informed decisions about the future of this site, and that staff develop a process to ensure that community concerns and perspectives are considered during the planning and implementation process.
Is that seconded? Second. All right. Councillor Heed, did you want to make further comment?
Yes, Mayor. Yes, thank you, Mayor. I did have some additional background that I'm just considering whether I'll read it or not, because I can tell you the presentations that were made from several people here were absolutely outstanding. If they cannot convince us to do a humane thing as a council here in Richmond, I'm not sure anything will. So I don't necessarily have to read this, and I just want to make some comments here with respect to what's going on. I indicated earlier there's a real misunderstanding of what we're proposing here. It's not an overdose prevention site. It is a supervised consumption site. And the difference is that this will be one that'll be run by Coastal Health, that'll have a health practitioner and others working there, so we can have the wraparound services that are required through our health authority. And it was very encouraging to see a letter from our medical doctor with respect to supporting this. A supervised consumption site is exempted by the federal government under the Controlled Drugs and Substances Act, Section 51, by Health Canada. When we talk about overdose prevention sites, we're talking about an exemption in British Columbia that's given by the Minister of Health, a ministerial order through Executive of Council. So there's a real difference between this. When we have people that are confusing this to what has happened, whether it be in Yaletown or some of the other sites where there are 12 in Vancouver at this particular time, is a real misleading approach to deal with this. Ours is a complete, comprehensive approach to get people in contact with the services that are necessary. Drug addiction, described to me by an addict, is 1,000 times worse than when you have the flu. And just, you can imagine how we feel, and I know you've gone through it, how you feel when you have the flu. When you talk about the fact that presenting something like this may have hazards, well, you know what? That's not going to stop me. Politically, I could care less. Responsibly, I care. I care about saving lives here. And when Mr. Tablotny read out Guy Felicella's letter, I'm sorry. He started to tear up, and I know Councillor Galanders, I didn't want to look up at her because I know she was tearing up. How much more do we need? This is a start. We've got to get these people in contact with the resources in order to get them out of the crisis that they're in. We as a council have taken a formal position on acute drug addiction that's killing people. We as a council have taken a position on mental health care and secure care for those people with significant mental health issues. This is the next step of us. And we will be judged by society on how we deal with and how we treat our most vulnerable populations here. I've had decades of working around this in policing. For a decade, I consulted around the world on public drug policy. When I was in provincial politics, trying to educate the provincial politicians with respect to this, working with then Inspector Frail in the downtown east side in the work that he put in trying to make the most, in my opinion, the comprehensive drug strategy, which was a 4 pillars approach to dealing with it. Unfortunately, we didn't construct all 4 pillars equally, and as a result, there is a bit of a crisis situation occurring. We will never have this honeypot effect that's alleged by some of the people that are opposed to this. It's not going to happen. People, as mentioned, are not going to go across bridges and travel long distances to go and utilize their drugs. When you think, I have a young 16-year-old daughter, and I think that the tragedy, if she ever got addicted to drugs, and the fact that we don't have the supports available. You can't just stop using drugs. It's not that easy. It's not that simple. Why people believe in that, I have no idea. When I was listening to some of the presentations here, I thought back into my time working in the downtown east side and going to a fatal overdose and sitting in an SRO or standing, waiting for the coroner's removal service to come, and there's someone lying dead right beside me. You know, how upsetting is that? Of course, we put on that brave face, as Councillor Hobbs will tell you, when we're police officers, and we do our job, we do what's required. But I can't stop thinking about, did we really do what we should have been doing? So the likes of, Ken Frail out there working, supporting it. And him and I took a lot of criticism from law enforcement. And I see our chief is up there in the back, and, he'll recognize this. And a lot of the criticism came from the federal law enforcement agency at that time and how we could actually make that particular change. So I just want to tell you, I can't be more proud of the people that presented here, and my heartfelt thank you to them. And there's no need for me to read this background, and I'll provide it to whoever needs it at this particular time. Thank you, Mayor.
Just before I go to others, I just want to clarify one thing. When you talk about the Richmond General Hospital precinct, I understand you're talking about the actual hospital grounds.
That is correct, Mayor. That's where we currently have our needle exchange and other harm reduction supplies that are available there. Yes.
Just want to make sure it's just not the wider area. That's
no.
All. Okay, Councillor Galanders.
Thank you. Thank you, Your Worship. Thank you, Councillor Heed, for all your hard.
Oops, sorry.
Yeah, and thank you to everybody who spoke. Like Councillor Heed said, it covered all the background and all the reasons why we should be unanimously supporting this on council without any issue. If you'd asked me a couple of years ago if I thought we needed this, I didn't think we did. I thought that most of our overdoses were happening in private residences. Things have changed, and if we just got our statistics in on our community safety report, and last year there were 27 overdoses in Richmond, up from 19 the year before. So that's a huge increase, and 14 of them were outside. 6 of them were on commercial properties, and only 7 of them were inside private residences. So that it has changed dramatically in the last couple of years. And we have all seen an increase in the number of people that are experiencing homelessness. We've all seen an increase in public drug use in the streets of Richmond, in our city centre area, a lot in part to the fairly flawed rolling out of decriminalization, which left cities with no recourse to move people along. And, in order to move people along, we do need somewhere to move people along to. And we don't have anywhere where we can direct people to, not be using on the Brighouse Baseball Diamond and go use at the supervised consumption site. So we need that in place as a first point. And, the hospital is the best place for this type of thing. There's the very successful new program at St. Paul's, the Road to Recovery detox program, which has, I believe, expanded to 75 beds. It started with 25 in the fall. And a friend of mine, Donna Culpit's letter really summed it all up about people in our community that are addicts, that are in recovery, that are upstanding members of society, and they experience a relapse. And I had a friend who had multiple years clean who experienced a relapse and spent 2 years very entrenched on the downtown east side. And she looked like somebody that you would just walk right by and think that they were completely hopeless. And she started accessing the harm reduction services, and through them I found her, and she got in touch with me as well. And a lot of back and forth, and a lot of little rocks on the journey, but she wound up in the hospital due to the complex issues that arise from using fentanyl, and she'd been saved from an overdose as well. And she got to go right into the Road to Recovery detox program at St. Paul's in October, and from there into stabilization, and from there into a treatment center, and she now has 4 months clean. So this works. We have to meet people where they're at, just like Donna Culpit said. Nobody is so entrenched in fentanyl addiction and able to just pick up the phone and get their lives back on track. You have to have contacts in the community, a safe place to go where you're not stigmatized and you're not afraid to talk about what you're going through. And this will work for people that are using inside private residences as well. I didn't even consider that, the ability to go and test your drugs. The only place that people could get drug testing strips was on the downtown east side. These should be available at the pharmacy. Kids that want to experiment with drugs, God forbid that it happens. It's the reality, for them to be able to just pick up a kit from the pharmacy and check their drugs and make sure that whatever they want to try is not something that's going to kill them. Why wouldn't we be doing that? Why aren't they already in the pharmacies? It's crazy. But if this place has drug testing, then people could go and get their drugs checked out. It's numerous benefits, and people do need to hit bottom. People need to want to recover. But like others have said, it's a different game today than it was even 15 years ago. People are dying before they can hit bottom. People are dying before they get a chance to want to get well. And anybody who's accessing a service like this is somebody who wants to probably get well. They don't want to die. And this could be something that keeps them alive, just like that letter from Mr. Filicella. And finally, that last time will be the time that they say, you know what, I'm sick of this. I want to get help. But we need that point of contact. We don't have that here. We need a lot of things in Richmond. We need another shelter. We need a detox facility, and we need more recovery beds. And I believe that by asking Vancouver Coastal Health to look at this, it's showing that we're serious about caring for our most vulnerable population, and that we're serious about moving forward with this type of thing, and this is going to be one step, and there'll be many more things to come, but this has to come first. So I'm really happy to be part of this motion. Thanks.
Okay, thank you. Councillor Hobbs.
Thank you, and through the chair. Well, first, thanks to the delegations for coming and speaking to us today. It's tough on any topic, and it's possibly more difficult on this particular topic. So thank you for sharing with us today. You know, and thinking about this, saying it would be nice to live in a society that didn't have an opioid crisis, didn't have a housing crisis, didn't have mental health crises. That would be really nice, but that's not where we are. And we've all heard the number that was set. It was a record we don't want to achieve last year of, I think it's 2,511 deaths last year, and that's up 5% just from the year before. So we definitely have a crisis. And I don't know if there's anybody I really know that hasn't dealt with this crisis, at least through their family, perhaps a cousin, perhaps a more distant relative. But I think everybody I know has dealt with it through people they know or through an actual relative. And certainly we've talked about our various careers, and I was in policing for over 35 years as well, same department as Mr. Frail and Councillor Heed. And you know, of course, you see a lot when you're doing that, and actually bringing up specific incidents triggered my mind a little bit. And yeah, it can be very traumatizing, and we're not the family that's dealing with the victim. We're just first responders who happen to be there. I have to say, nobody chooses to become an addict. It's not a choice people make. It's not a choice anybody would wish upon themselves. And when I think about my own family, if it wasn't for, some people might say being blessed, but I wouldn't say that. I'd say it's just being lucky and, you know, making certain decisions or not making certain decisions, or peer groups or certain peer groups that you didn't have, or going left instead of going right. It can be fairly random, and people don't choose to become an addict. It crosses all lines, it crosses all races, all ethnic groups, it crosses all socioeconomic groups. You talk about the downtown east side, well, let's talk about Shaughnessy. I mean, I've been to lots of calls there as well, and some of them do come to mind right now, actually. The thing with drugs, and Mr. Frail mentioned heroin in the past when we all started in our careers, but it is important to just mention a couple numbers here. Fentanyl is 50 times more addictive or more potent than heroin. It's 100 times more potent than morphine. And carfentanil is 100 times more potent than fentanyl. So you're dealing with astronomical numbers that people really don't have a chance with if they get a cross-contaminated product or a poison drug supply. So I'll also say that most of the victims, from what I've read, are men. It's not that women can't be, it's just that statistically most are men, and most are up to the age of about 60. The 4 pillars approach has been mentioned, and I agree that unfortunately we never got all 4 pillars working at the same time or to the same extent, but those are prevention, enforcement, harm reduction, and treatment, and education is a big part of it as well. So those have never been equal, and they've never been funded to the same extent as some others. So it involves a lot of different organizations too. There's a lot of partners involved, and we've heard a lot about that, and thank you for bringing that up. But government is involved, obviously, non-governmental organizations, community groups, police, fire. And it's interesting if you read things from police, actually, and the Canadian Association of Chiefs of Police, and it strikes me that you have 3 police officers who are retired now, but all essentially with a very similar, if not the same message. Probably over 100 years, I think, of policing in that. Don't want to add that up. But it also involves early intervention, prevention, housing is a part of it, mental health, treatment. It's about a pathway out. It's not that every single addicted person is going to use this facility. They're not. It's not that every single addicted person is going to use this facility every time they use drugs. They're not. It's about having that pathway out for those who choose to use it or want to use it at a certain time. It is wraparound services. That's very important. It's about referrals. So the supervised consumption site, which is an exemption under federal law, is one of the options, and that's what we're talking about here. So harm reduction, reducing overdoses is part of it. It's not about, you got to be realistic. Is anybody going to die still? Unfortunately, yes, they are. But it's about reducing overdoses and reducing deaths. It's about connecting people to services, detox, mental health, housing. It's all part of it, and it's all interconnected. It's very important that at a consumption site that you have staff, that you have nurses, that you have counselors, that you have peer workers. That's all very fundamentally important too. Now, the BC coroner has also noted that 2/3 of the deaths, 2/3 of the overdoses now are from substances that are inhaled. So it's not the old stereotype that you might think of as somebody injecting drugs. That still happens. But 2/3 of those who die are inhaling the substance. So what's really important in a consumption site nowadays too is to have the inhalation ability. And that brings other challenges too for your workers and work safe and things like that, but it can be worked out, but not all of them have that right now. But it is important. So these sites are often also most beneficial to the most marginalized people in our community. And we've heard a little bit about that, but I do agree with that. So it's not a magic solution. It won't solve all the problems. There can be social disorder associated with sites, and that's something that we have to be very mindful of, and our city has to be very committed to ensuring that that is minimized as well. But that's one reason why the hospital location is actually a good location. That will help in accomplishing that. So the crisis is a reality. This is about minimizing impacts. It's about saving some lives. It's about giving some people an off-ramp from the addiction that they're suffering under right now. And if we don't have things like this, it's more challenging to get people into treatment and off the path of addiction that they're on. So I will be supporting it because it's an important part of the overall puzzle and assisting people in getting off that path of addiction. So thank you.
Okay, Councillor McNulty.
Yeah, thank you, Worship. First of all, thank you to the presenters. Your presentations were extremely powerful, very realistic, and greatly appreciated. You told the story. I'm not going to, Your Worship, I'm going to make a few comments, but I'm not going to go over. First of all, I do want to thank Councillor Heaton and Councillor Calanders for laying this out. It's very explicit of what we are going to do. You have to read it very carefully. It's in great detail. You can't skim what is happening. But more importantly, I want to talk about who are we talking about? We're talking about our own fellow human beings in Richmond. So we're talking about today. We're not talking about Vancouver. We're not talking about elsewhere. We're not talking about provincial governments and whatnot. We're talking about people and the value of a life. The value of a life. You are all very worthwhile and valuable people. We all feel good about ourselves, don't we, about that? Something we did when we were in school, that I would talk to my clients that they were very worthwhile. But some of them didn't feel they were as worthwhile, but they knew I cared. And I was able to do what I could for them in a whole different manner. Because, you know, across the street could be you. I don't think there are too many in this room even know what's across the street. You got to go there. I've been there many times over the last number of months. What I'm trying to make a point here is it's great to say we've got a mechanism here of which we can follow, and we can try to help people to stay alive, because that's what we're talking about, keeping people alive. Yeah, hopefully they will recover. We can help them, partial recovery. We heard people going back in, coming out, going back in. It's a very complex problem. If you knew the story of a couple of people across the street, every one of you in the room would be crying right now. Just going to mention the woman that I'm dealing with over there had her husband's throat cut. in Richmond. Keep thinking about that. These are the people we're trying to help. It's our problem and it's everybody's problem. And yes, people are passing it on. They don't think it's a big thing. It is. People are important. And what's happening all around us, it needs a reaction. It was mentioned here, taking installs spent by council. Drugs in homes. I counseled up in Kerrisdale, the south slope of Vancouver. I can tell you what's in the homes. It isn't just a bottle of Johnny Walker in there. Okay? And I'll leave it at that. And it is happening all around us, and we cannot avoid it. We have to take action. We have to do something. Folks, it's like across the street with homelessness. Thanks to all the councillors. And Carol, we've done something. We've got some people. We're going to try to get outreach workers. We're going to try to do something. And I think that is a future step. We need more education, not for those that accept this proposal, but for those that deny it and don't want to do it. What is your solution? You want the city safe. We're trying. We're doing our best with what we've got in resources. If there's a better solution, I'll buy it. Matter of fact, I'll buy 2 of them. Let's get it going. I'll contribute. Okay, give me a solution of what we should do. I think we need to try before we pass judgment on what's the right thing to do. I think things are laid out here nicely. It's under the shield of professionals, those that know what they're doing and can handle the situation. We talked about connections, a couple of our comments up from people up there. The connections will be made with those people, just as they do with a police officer, for example, in a situation, or a counselor, or a doctor, or whatever. So I think from the humanistic point of view, we're obligated to continue to try to make Richmond safer, make Richmond a better place, but to educate those that don't have the same amount of knowledge that we may have in what this will do and how this will help and how this will move people forward. I think that that's a big thing, and how we can do a public relations program to let people know the things are out there. We always talk about the other things that we do, that are sort of business from day to day, but we don't talk about the humanistic thing, the opportunities. This is an opportunity for us, but more importantly, it's an opportunity for the clients that we out there. And it gives them hope. And with hope comes further development down the road. So, Your Worship, I will be supporting this. And I hope everybody, this is a unanimous vote tonight, and everybody will support it because, as it was mentioned, it is a crisis. It's an emergency. We need to be dealing with something. But more importantly, we cannot lose the opportunity. If Vancouver Coastal Health will accept this challenge at their site and deal with Health Canada to set the site up, then let's go for it. Thank you.
Okay, Councillor Wolf.
Thank you, Your Worship. A lot has been said and much more valuable contributions than I can from my lived experience. So I'll just say a few brief things. One is to reiterate that Dr. Mina Dwar, our medical health officer, did submit a letter today that probably the public's not aware of that outlines Vancouver Coastal Health's support for the overdose prevention service listed in front of us today as the supervised consumption site. In there, she does outline that it is support for the analysis in order to identify a range of solutions that may be appropriate to our local context here in Richmond, to the exploration of feasibility, acceptability, and funding models that are important to undertake in partnership with clients, service providers, and relevant public sector partners. My big question is, why do we not already have this? Why do not the regions throughout the world that are dealing with this toxic drug crisis not already have this, not already have places for clean drug testing? Yes, Richmond is an island or multiple islands, but that does not isolate us from the crisis. We have ports, airports, boat ports, that are fueling the fentanyl spread around the world. This is not going to go away in this region. We're bringing the world here with this FIFA World Cup in the coming years. We're not going to be a quiet place anytime soon. This is going to be a happening place. People are going to have times that are going to be that cover the gamut, cover the spread of joyful celebrations and the worst of it. To meet people who have been broken by this at such a personal level, it's just, yeah, it's hard to go any further than to say that we're asking today here in this motion for Vancouver Coastal Health and the province to do what I think should already be done. So it's a no-brainer to go forward and support this. Thank you.
Councillor Howe.
Yes, Your Worship. This is a very complex problem, and I have a lot to say, but I will try to be as briefly as possible. First of all, I would like to point out that this motion by itself is really a direction to staff to implement a consumption site program. So it's not just a direction to staff to do a study. I was being stopped by many people in the last week since this news came out that this motion is coming to today's meeting. I received lots of phone calls and emails, and people are asking me, is this coming to Richmond? Now, I try my best to convince them, no, the council has not made its decision. It's still an open-end study, but they said, look at the motion itself. The first paragraph talks about doing a practicability analysis. But then from 2, 3, 4, 5, 6, it's actually talking about implementation, the programming, and how it should be done, right? So this is not an open consultation or an open study. It's really a direction to staff to do it with the cover of having a practicality analysis. And that's why people felt that decisions has already been made. And this is why many people felt that they are not being listened to. Secondly, talking about experience of the drug issues or drug problems, I can tell you that I was a probation officer in Hong Kong for 5 years. And during those time, I have lots of my clients being juvenile or adult drug addicts. So I have some understanding of the drug culture, drug behavior, and the impact of drug addiction to the lives of the people. So I'm not that ignorant about these issues. And I've also worked with the Richmond Health Department as the mental health consultant for 22 years. So again, I've both experienced overseas and in Canada. I think the debate about whether or not supervised consumption sites would save life has to be drawn to a bigger picture, which is the injection site approach to address overdose deaths. And let's look at the numbers. Vancouver opened its first injection site back in 2023. And since then, the number of injection sites has grown to over at least 14. I know that it could be more than that. I tried to get the numbers straight, but I was not being given the accurate number. So I think there's at least 14 injection sites in Vancouver and 41 in the province. And additionally, there are 90 check sites. Again, I don't know where they are, but from my research, I found out that there were 90 check sites. Now, one would assume that with the increase of injection sites, we will see a decrease in the number of overdose deaths over the years. Unfortunately, that's not the case. And as we all know, in 2023, we hit a record high of 2,511 overdose deaths. So the question is, if injection sites were truly effective, we should be witnessing a decline in the number of these tragic deaths. There was an argument saying that there's no deaths in supervised injection sites. I question that. I think it's not completely true that no deaths occur in injection sites. As we know, there have been at least 3 deaths in the temporary modular housing on Alder Bridge Way in the last 3 years. So deaths happen in supervised injection sites. I think the problem lies in the nature of injection sites themselves. They function as maintenance programs, allowing individuals to continue using drugs indefinitely. We must remember that drugs are inherently harmful substances, and no matter how safe they are taken, they will always have negative health consequences. The damage caused can be irreversible. To illustrate my point, let's imagine that people are drowning in the water. What we are currently doing is provide them with life jackets to keep them afloat. While this may temporarily save their lives, we are not actually pulling them out of the water. Eventually, they'll sink over time. Moreover, we are not addressing the underlying reasons why people are falling into the water in the first place. Perhaps what we need to do is to fence off the water to prevent people from falling into it. Time and again, people have mentioned that Richmond has the lowest rate of drug abuse and the lowest number of overdose deaths. And I think it's worthwhile for us to look into the reasons why Richmond is actually doing better than other cities, and what lessons that we can learn from our experience that can be applied to other cities so that we can address the drug issues. Some argue that the increase in overdose deaths is due to insufficient injection sites. While I understand that perspective, the question we need to ask ourselves is, how many sites are enough? Overdose deaths can occur randomly. And to completely prevent them, injection sites would need to be available anytime and anywhere they are needed. If we approved the injection site in the city center, it's highly likely that requests for sites in Silverstone and Hamilton will follow. So while we may be discussing one site for now, there will be more to come. It's been argued that we need more because people living in Vancouver may not come to Richmond to use the site, or vice versa. Drug users in Richmond will not go to Vancouver to do it. The same question or the same concern is also applicable in Richmond. Do we expect people living in Stevenson will come to the hospital site to do it? I mean, many of them will just feel that this is so inconvenient. So at the end, we will have more than just one. Now, let's also not forget that Vancouver Coastal Health has repeatedly stated that injection sites are not a priority in Richmond. Of course, you know, Dr. Dinwo gave us a new letter today saying that she's in support. But also in the letter, she mentioned that actually the number, that's what she said. Richmond has the lowest rate of drug toxicity deaths in BC, and the numbers have stabilized and are slowly coming down. So while she's supporting that, okay, we should have this injection site here, she's also pointing out that the problem is under control and is slowly coming down. I think if we are talking about the health crisis in Richmond, I would like to point out one thing. Perhaps the real health crisis in our city is the fact that 44,000 people do not have family doctors. Should we not be addressing this pressing issue before implementing injection sites? In conclusion, I urge you all to carefully consider the implication of this proposal or this motion on the neighborhood, the community, and the prioritization of health issues in Richmond. And I just also want to add that I understand why the people in the neighborhood of the temporary modular housing are so concerned, because they always felt that they suffer from the impact of having the temporary modular housing there. And if there's another injection site in the area, it will be a double dose for them. So I think that's why they're very concerned, and I understand that. So, Your Worship, with that, I have to say that I would respect the motion, the mover, but at the same time, I have to respect those people who have expressed a very strong opinion that they're opposed to having this injection site in the Richmond City Center.
Councillor Liu. We need to stick to the speaking order, I'm afraid. We've got some others. No, we'll get, you can make tell us your information, but after Councillor Liu has spoken, she's been waiting for a long time. Go ahead.
Thank you, Worship. And thank you to everyone that came out and spoke today. I know it's an extremely personal issue for a lot of people. We all know somebody or some people that this is affected. I do look at this and I look at that it does say essentially that we're asking specifically for a drug consumption site. And then when I look at Dr. Dawar's letter, she suggests that we should actually be identifying a range of solutions that may be appropriate to our local context. That may include a consumption site. It may be something else. It may be the detox facility that has been brought up. It may be treatment facility. It could be a number of things. I was sitting in my car today and I was looking down and I have a pen from the last door, which is an addiction treatment facility in New West. And I think there's a range of things and a range of ways to treat people. And I wonder if through this process we would find out is a consumption site the most important investment in healthcare in Richmond right now? It may be. Is it the best investment to treat people with addictions here in Richmond, or are one of these other options, or is a combination of these options what we're looking for? I don't know. I know that when we changed our rules around drug consumption in BC and people were talking about the Portugal protocol, I went and read it. And I went in to see, is this what we're doing? And it's not what we're doing. We're not doing the Portugal protocol. We're looking at unintended consequences. And I was looking up something on the local website, and it talks about there was a 61% decrease in the rate of death from causes the week after a prescription was filled. So if someone got an opiate prescription, there was a 61% decrease in deaths the week that prescription was filled. And so that's good news, right? But then we hear about the story about kids getting these opiates on the secondary market too. And I think there was a young girl that passed away because she still overdosed on it. So you can still overdose on prescription drugs. And so that's why I think part of this motion that talks about the importance of education is extremely important. But I would like to make an amendment that we add identifying a range of solutions that may be appropriate to our local context. So it may include the implementing a drug consumption site. And we may get more information that includes other pieces as well.
Okay, what would the exact wording be for what you're suggesting, and where would it go?
I think that staff perform an analysis to identify a range of solutions that may be appropriate to our local context.
Where are you reading from?
In the first motion, so to adjust the first motion, so.
The first paragraph?
The first paragraph. So right now it says that staff administer a practicability analysis to gauge the potential benefits and challenges of implementing a drug consumption site within the Richmond General Hospital precinct.
Yes.
I think it should say that staff identify a range of solutions that may be appropriate to our local context and administer a practicability analysis to gauge the potential benefits and challenges of implementing a drug consumption.
Identify a range of solutions that may be appropriate to our local situation and administer, et cetera. So you're basically widening the whole scope of
Yes.
what's in front of us. Is that seconded as an amendment? Not seconded. Go ahead. Are you finished?
Yeah.
Okay. Councillor Heed, you wanted to provide some more information.
I'll do that after Councillor Day's finished, and it'll be my wrap-up, Mayor,
Okay.
if that's all right.
Yep. Councillor Day.
Yeah, thank you, and I appreciate Councillor Liu's suggestion that we amend this, but honestly, we're already doing it. If you read the 6 paragraphs in this motion, we cover pretty much all the guidelines. And even if you read the Dr. Dawar, our health authority, our medical health officer for Richmond, she specifically says that she supports the motion calling for overdose prevention services, and this the unregulated drug toxicity crisis has an enormous impact on Richmond residents, families, and service providers. 172 residents of Richmond have lost their lives since the public health emergency was declared in 2016. And then she goes on further down to talk about the various services that are available in Richmond and how we can work to enhance and navigate the treatment journey of someone who is drug addicted. There's just so much I want to say, but I'm going to try to be brief because I think everybody wants to go home. I know of 3 families that have lost an adult son that died because of this crisis. All of them were men, all of them were gainfully employed and part of the process. Think about all of the people, all the men who have died and how it has affected our workforce over the last, 4 or 5 years. And, I believe that if these folks had the opportunity to test their drugs and have a place to go and use those drugs, they would actually be alive today. The other day, I went to Brighouse Church site on Bennett Road because I was told it was up for rent. And I thought, well, maybe we could use that for some of our homeless. As I drove around the back in the rain, there was 2 people using drugs at the back door. I looked over, and about 30 yards away was a child care center, and the playground was just the other side of a 3-foot-high fence. Had we had a consumption site, I would have offered to those 2 drug users, can I drive you over to the site? Because this is clearly not the right place. And I believe they would have listened because they looked to me like they felt guilty about being there, but they had nowhere to go. And I believe I could have easily have taken them over there. So if we get a consumption site, which I think we should, I will be supporting it, Vancouver Coast Health Authority will see by the numbers and the statistics how successful it is, and likely we would get more detox centers and rehab centers and kill this problem once and for all. So I do have a question of staff. I'm not sure if I can ask that now.
Go ahead.
Okay, well, I can just say it, and maybe they can come up later. What I'm wondering is if we can provide those statistics, is it likely that Vancouver Coast Health Authority would take it to the next level and give us those detox centers and recovery centers? And then I'd also like, as part of this report, when it comes back, and it's going to be a huge analysis, to do the numbers. And as we had the Tabotnys come up earlier and say that there were 40,642 deaths since 2016, and 39,435 overdoses and 16,832 hospitalizations. I believe the numbers themselves justify asking Vancouver Coast Health Authority to open this consumption site. And I think that we have to, for those who don't care about drug users as far as they're concerned, they're a write-off, let's at least look at the numbers, because we might be able to convince some people on the practicality of this, if not the human side of this issue. I believe that, well, for me, when I looked at this motion, I read it carefully, time after time after time, and what completely swung it in the yes for me was that this will provide comprehensive care, access to comprehensive care, including access to addiction treatment and harm minimalization services and counseling. And, there is some people on this council that have worked in counseling in the past and should know that that's the first step, is you gain the trust. As we heard from Mr. Byer, he came here and he thanked you very much for the information that you gave us, because what he did was he dispelled the fear-mongering of Mr. Sterrett, who said that St. Paul's was closed because someone there was killed that worked there. He confirmed that St. Paul's is in fact open, run by Raintree, and is helping people, and that 89% of these folks end up going to detox, and there's been a 35% drop in deaths. Just think about that. That's pipe fitters and welders and construction people that wouldn't be dead today. That would be dead today if it wasn't for that service. So hearing from an insight worker, hearing from outreach workers, hearing through families who have had first-hand experience and loss, and I can't thank you enough for coming forward today. I believe we have all the information we need to move forward with this. But the motion clearly says that staff administer a practicability analysis to gauge the potential benefits and challenges of implementing a drug consumption site. So this is up to Vancouver Coast Health Authority, and I wrote back to all the people who wrote us, not really understanding the facts because of fear-mongering in the press and by some people in this community, that this is about sending this information to the powers that be, Vancouver Coast Health Authority, and let's see what they come back with. We may have a hybrid model for all I know, but we won't know until we approve it. So no, we're not Portugal, we're not Hong Kong. What we are is Richmond, and we have a made in Richmond problem. We need a made in Richmond solution, and I believe this 6-part referral absolutely deals with every aspect of it. And I thank Councillor Heed, Councillor Galanders for bringing this forward. I thank previous Vancouver City Police Officer, Mr. Frail, for consulting and providing valuable information so we could get this right. And we'd be foolish not to approve it. And when it comes to, again, more fear-mongering, well, if we open one at the hospital, there might be one in Hamilton, there might be one in Steveston. I don't buy that. If you look at where all the deaths are happening on this map, they're happening in the downtown core, and it has to be attached to the hospital. That's the key, because if we can get them into the consumption facility, and then they're willing, because they've now gotten to know the people who work there, to take more health care, to go up to the second floor and be checked in and end up getting the help that they need for all the various health issues that they have. So I'm going to be supporting this 100%.
Thank you, Councillor Heed. We've gone on for a long time. We've still got a lot of agenda left.
Maybe. But
no,
just,
it'll be short.
It'll be short. I'm just kidding. I got to tell you, to use that word that Councillor Day just used is fear-mongering. We have had people that are now fear-mongering this particular issue, and this is the point of information, giving out their own statistical data when we have empirical data to support what's going on. And I think that is absolutely appalling for an elected politician to actually do that. That's my point of order. And understanding, for the third time, There's a difference between a safe consumption or a supervised consumption site and an overdose prevention site. Overdose prevention site is a peer-run room. Supervised consumption sites are run by health practitioners under coastal health. So you need to have that understanding, and if you think there is some type of conspiracy in the motion that's been put forward, that's up for vote, I think you really have to reconsider and read it once more and realize there's no conspiracy here. We're not going to open up all of these, as Councillor Day said, in every single community in Richmond. That is inappropriate fear-mongering, in my opinion. And to sum up, I want to read a quote from our courageous coroner, Lisa Lapointe. They're trying to stay warm or stay dry or stay safe. If public drug use is greater, is it due to decriminalization or is it due to more people having nowhere to live? Decriminalization didn't cause inflation. Decriminalization didn't cause the housing crisis, regardless of what some people want to believe. We've heard the delegation previously on the low barrier housing talk about that public drug use. That's exactly what we're trying to address, to move them out of the public eye, to put them into somewhere where they're not going to overdose and be passed out in an alcove, on a bench, or in an alleyway, as Councillor Day said, near a playground. We've had this decriminalization process that's in place. It's challenged by the courts right now. I'm sure the appeal courts and their deliberations are going to go, well, if you want to limit it in some public areas, where are you going to send these people? This is for the police officers that work for Chief Shohan here, and for the firefighters, and for our outreach workers that are going to be able to direct these people to this particular location to save their lives.
Okay. With that, we're going to call the question on the motion. All those in favor? Those opposed? It's carried with Councillor Au opposed. May I have a motion to adjourn? Okay, we're now adjourned. I'm going to call the Finance Committee meeting to order. May I have a motion on the minutes? On the minutes. Moved and seconded. All those in favor, opposed, carried.
Move the investment report.
Okay, moved and seconded. Anything to add to your report?
Through Chair, there's nothing to add to the report.
Okay. Councillor Wolf, we're really running late. You have a quick question.
Yes, thank you.
Excuse me, folks. Excuse me, folks. We're continuing here. If you want to leave, please do it quietly. Go ahead.
Thank you, Your Worship. My question is in relation to the environmental, social, and governance rating. So I read in the report that we're considered for the AA score. I'm just curious, two things about it. How far off were we from the AAA score, and do any municipalities get the AAA score? Thanks.
To the Chair, to Councillor Wolf. The AAA score is to account for the holdings that we have in our investment portfolio. So pretty much all our holdings are in the AA category, meaning that we're investing in companies that are socially responsible, meeting all the ESG criteria. We do not have information on the other municipalities, but just looking at the universe of investment that we're allowed to invest in, for example, the banks, only one bank will be in the AA category. All the other major banks in Canada are also all in the AA category, being a leader in the ESG area when they do their business. And governments per se, provincial governments are all in the AA also category, and there are some in the A category. So we are already doing our best based on the diversification that we need in our portfolio holdings.
Thank you.
Right, we'll call the question then on the motion. All those in favor? Any opposed? That is carried. And on the borrowing bylaw, it's moved. Is it seconded? Moved and seconded. Discussion on it. I will call the question. All those in favor? Any opposed? That is carried. Some adjourned. We are now adjourned.